Hi everyone, my name is Dr. Ashimi. I work for IMGC Clerkships. I'm a professor that helps teach their USMLE board review programs. We've developed a few videos to help you identify skills to answer questions efficiently and also learn key concepts that are required to do well on the USMLE board exam. This question is asking us, what is the most likely reason dextrose, which is a sugar, improved this patient's symptoms? So what are this patient's symptoms? We had a 26-year-old female who comes to the clinic with acute onset of abdominal pain, nausea, and confusion. These symptoms are quite general. It's difficult to make a conclusion based on what you see here. So you have to read a little bit further to better understand what's going on. Her past medical history is significant for a late menarche at 16. She does not use any tobacco, alcohol, or illicit drugs. Liver function tests and lipase levels are normal. CT scan of the abdomen shows no abnormalities. So at this point, everything so far has come back normal in terms of diagnostic studies. Her urine is red. Normally, urine that's red indicates that there's blood inside the urine. That's the most common cause of red urine, unless somebody's taking medications that may discolor their urine. And further, they say it darkens after standing 24 hours. Most things that go through this darkening process is due to oxidative damage to the proteins that results in change in the coloration of urine, specifically in this question. So you can now conclude if the patient has RBCs inside their urine and there was some discoloration to the urine after it sat for 24 hours, look at your answer options and see if anything is related to RBCs or the synthesis of RBCs or the proteins that are found in RBCs. You know, fatty acid synthesis has nothing to do with RBCs, and you can go ahead and rule that out. Protein synthesis is quite general. It doesn't directly target RBCs or the hemoglobin, the protein that's found in RBCs. So we'll leave that in just in case. Ketogenesis. This is related to energy metabolism. So in patients who cannot utilize glucose, will utilize ketone bodies as a source of energy. Again, nothing to do with RBCs and why they're found in the urine. Gluconeogenesis, the formation of new glucose. Again, this is an energy metabolism issue, not related to RBCs or making of hemoglobin. So you're left now with porphyrin synthesis. And porphyrin is a protein that's used in hemoglobin synthesis. And protein synthesis is the other answer option, and like I said, too general, can't really conclude anything with that. So, why would it be porphyrin synthesis? So you know in heme synthesis, you have inducing agents that increase hemoglobin synthesis and inhibiting agents that decrease hemoglobin synthesis. In this patient, dextrose was given, which improved her symptoms. So if she is making hemoglobins that are improperly formed, which would result in things like hemolysis and hematuria, you can conclude that the fact that you see red urine that darkens after is because of RBCs are found in the urine, and you have a hemoglobin problem, porphyrin synthesis, which is a common finding in patients who have inability to form heme. Dextrose, which is a sugar, inhibits hemoglobin synthesis, and this also would include things like lead, would also decrease hemoglobin synthesis. So we can conclude that the answer here is porphyrin synthesis. By giving dextrose, we're inhibiting her hemoglobin, therefore decreasing what's found in the urine, and decreasing her symptoms, which is the pain, nausea, and confusion.